Hi everyone, welcome to the YouTube channel fmge Dr. This video is going to all about the neurosurgery, proper neurosurgery. We have already seen the plastic surgery in the previous video. This video is going to be all about the neurosurgery. So when we start to read the neurosurgery, first start with the anatomy. Okay, anatomy, I mean not the proper like the first year anatomy. You have to know about the surgical anatomy only, about the spinal cord a little bit, and the circle of Willis you have to know, the blood supply of brain. Read about these two topics from the anatomy, then come back to the neurosurgery. And when we start to read the neurosurgery, first we have to know about the neural tube defect. From the neural tube defect, so many times it has been asked about the meningocele and meningomyelocele. So you must be able to differentiate between these two condition, meningocele and meningomyelocele, and they give you the even image-based question as well. So read about this topic properly, and after that, after reading the neural tube defect, you have to know about the some malformation of the brain. That includes the first Arnold Chiari malformation. These malformation are of two types, and you have to know about the type 1 and type 2 Chiari malformation. Their image-based CECT has been asked already. So look at the CECT image and look at the topic. These two topics as well. I mean a little bit. I mean how to differentiate between the type 1 and type 2 basically. Then third is the Dandy-Walker malformation. Read about the Dandy-Walker malformation. Even from this topic also the CCT image has been already asked. And fourth is the the vein of Galen malformation. So even from this vein of Galen malformation also the CCT image has been asked. So look at the image, okay, from the notes. CCT image from all this congenital malformation, and read about the malformation. As we move from the congenital malformation of the brain, then we have one topic, that is brain abscess. We read about the brain abscess. It's a very small topic, you know. Just see the NCCT image of the brain abscess, how to identify the brain abscess on the CCT image or NCCT. Okay, and then what is the feature of brain abscess? They generally ask, and they ask about the neurocystic sarcosis as well. So look at the neurocystic sarcosis image. Okay, so this was about the the little bit small topic which they generally ask from the neurosurgery, but the major chunk of the neurosurgery is about the hemorrhage. Okay, you have to know all the hemorrhage, like we have the epidural, subdural hemorrhage, intracranial hemorrhage. We have the all type of hemorrhage. Hemorrhage, like they will give you the scenario, and they would ask you that what kind of hemorrhage it is. So you must be able to know. I mean, you must be able to answer that question about the hemorrhage. And sometimes they give you the CECT image. CECT image or NCCT image is very important from the hemorrhage point of view. Even you don't know the theory, if you just know the CT scan image of the brain, so many times, at least from the radiology part, you have done, and you can solve the question from the radiology part of hemorrhage. So look at all kinds of hemorrhage. Okay, subarachnoid hemorrhage is very important. Most of the time they ask. Epidural hemorrhage is very important. Most of the time they give the scenario about the lucid interval, and they ask from you. And the next thing is diffuse axonal injury. Diffuse axonal injury is very important. They love to ask about the NCCT finding of diffuse axonal injury, and what is the investigational choice of diffuse axonal injury. Okay, so read about diffuse axonal injury as well. The hemorrhage, it is included. So this was all about the hemorrhage. After that, you have to know one complication of the hemorrhage. When we do not treat in that situation, this kind of the complication occurs. So this is Carnohan's notch phenomenon. Okay, that is also known as the brain herniation syndrome. So read about the Carnohan's notch phenomena. They will give you the image based. They will give you the diagram, and they will locate one arrow, and they will ask you what part of brain is getting herniated in that image. So read about the brain herniation syndrome, that is Carnohan's notch phenomenon. Okay, so this was about the the one side of neurosurgery, that is about the hemorrhage and some malformation, some defects, and like the abscess. Now, one side of neurosurgery is about the tumor. Okay, so in tumor you do not have to go to the very depth, to be honest. Just you have to know about the 4 or 5 tumors. Their histopath is very important. You have to know the histopath of all the tumors. Okay, and their how to identify on the CECT. You have to know about all the tumors. So the first tumor is meningioma. Meningioma is very very important. You have to know each and everything about the meningioma, their histopath, their CECT, everything you have to know. Second is the astrocytoma. In astrocytoma, you have to know about the grades. There are 4 or 5 grades, I think. So you have to know about the grades of astrocytoma, and mainly in astrocytoma, they will ask about the glioblastoma multiformis. Their CCT image has been asked so many times about the glioblastoma multiformis. So look at about the astrocytoma types. Okay, so first is the meningioma, second is the astrocytoma. Okay, third is the medulloblastoma. Same, very important, even from the pediatrics point of view. So read about the medulloblastoma. Okay, fourth is the oligodendroglioma. Read about this. Their histopath image like the chicken wire appearance has been so many times asked, you know. So read about that as well. I mean the oligodendroglioma, and sometimes they, ask the one-liners like for the metastasis, the brain. They ask what is the the most common scenario in which the brain tumor occur. That is the mostly the metastasis. So read about little bit the metastasis. In which situation the metastasis goes to the brain. So read about this. Okay, so this was all about the tumors, and one two tumors which even you will read in the, I think, ENT also, that is the acoustic neuroma. So read either in your surgery or go to the ENT or read there about the uh, acoustic neuroma. Okay, so this was about the tumor, and one tumor is pituitary adenoma. Even you will study in the your what's it, the medicine part about the pituitary adenoma. So it depends on you about the acoustic neuroma or pituitary adenoma. Where do you want to study? If you want to study in the surgery, it's okay, but you can study in the medicine, and about the acoustic neuroma, you can study in the ENT subject. So it depends on you. So this was all about the basically the neurosurgery. Neurosurgery is like, you know, it's not very used. I think very small chapter. It's not very large chapter. So read about this all topic. Make sure that at least you know this much about the neurosurgery from the neurosurgery chapter. So I think you can solve the 90% of question in your PYQ. So read this topic and solve the PYQ together. Okay, and I think this will be enough for the upcoming exams. So so it's enough, I think. So okay guys, thank you.